Direct and indirect effects of climate change will cause an increase in mortality and morbidity rates. Changes in the burden and distribution of many climate-sensitive diseases, with vulnerable groups facing more drastic health outcomes. Recent floods we've seen, dust storms, polluted air, the heat we're living, droughts spreading, raising sea level, all will affect our health, putting more pressure on health systems and service delivery. Do we need a new pandemic to start acting? We need to build our health systems to be climate resilient and environmentally sustainable through oriented leadership and governance, climate smart workforce, climate risk assessments and early warning systems, more resilient and sustainable supply chain, emergency preparedness and more informed programs, and sustainable finance. Every effort is crucial if we want a health system that can protect our health and future generations. Without action, climate change will undermine decades of progress in global health.
We will now going to move on the second panel of today's event. It's a pleasure to welcome everyone on this session on advancing sustainable initiative for climate resilience healthcare systems. We find ourselves at a pivotal moment to reflect on the progress made in the Middle East and Africa and reinforce our collaborative efforts toward building low-carbon, sustainable, and climate-resilient health systems. We want this session to lead to transformative actions in the healthcare sector for sustainability and resilience. Our discussions aims to shed light on practical, actionable solutions and collaborative strategies that emerge from partnerships between the public and private sectors, as well as NGOs. So without further ado, it's my pleasure now to welcome experts in the field to provide their views and to discuss actionable solutions. Professor Ahmed Taha, Head of the General Authority for Healthcare Accreditation and Regulations. Welcome. Dr. Steve Holt, Director and Chief Executive Officer of Taha Kidney Care. Welcome. Dr. Bassam Kaddissi, Executive Council Member and Chairman of the Healthcare Sustainability Division, Arab Hospitals Federation. Dr. Wael El Delaimy, Overall Co-Lead Principal Investigator at GeoHealth Hub, Professor of Public Health at UC San Diego. Welcome. Ms. Desta Lakew, Group Partnership and External Affairs Director at AMRF Health Africa. Welcome. And finally, Mona Issi, Executive Director of AGH. Thank you so much for joining us today for the part 2 of this event. And I want to start with you, Dr. Wael El Delaimy, because the minister touched upon the critical role of data in taking action. So I really want to first have a look at the climate and health research, especially in the MENA region. And I want to ask you, what are the unique challenges and opportunities that we are facing, and how does GeoHealth Hub aim to address them? And if you can explain very quickly what's GeoHealth Hub before.
Thank you very much. Thanks for the opportunity, and thanks for Center for Environmental Health Action and Engineer Mazen and the IMRO for inviting me on this panel. As a public health professional and in our field in epidemiology, public health, we did not pay attention to climate change impacts until recently. Everybody in the physical sciences and the atmospheric sciences were already knowing about the climate change impacts since 1960s. But it was only when these extreme weather events began to hit and show, then the attention to health came. For the MENA region, it is going to be the ground zero. We're already seeing the impacts of health of the climate change, whether it's the extreme record heat records, or the scarcity in water, or the dust storm frequency, or the lower precipitation. All of this is in the MENA region. So that caught my attention a few years back. And with colleagues, we had a book that I edited, and one chapter was dedicated to the MENA. When I was looking at the data, there was no data. The only data for the MENA region was mostly from the World Bank. And these are more, less technical or less research-oriented and more about the finances and the cost and so on. So I used that. But I was dedicated to try and find a solution. And that's when the GeoHub came, which is the Global Environmental and Occupational Health Hub. And we are the only hub on climate change and health globally. So, and we are localized in the MENA, or focused on the MENA. The idea is that we would fill in the gap in many aspects of climate change. First, there's lack of awareness. Second, there's lack of capacity. Third, there's lack of partnership. Fourth, there is lack of data. So the GeoHub is formed of 6 universities: Harvard, Berkeley, University of California, San Diego, leading this. And from the region, we have Jordan University of Science and Technology in Jordan, Balamand University in Lebanon, and Mohammed Sadis University in Morocco, plus the CDC, plus the WHO represented by CHAP. So it is a really amazing platform and a tool that is there to help the region. We have 45 experts in every field you can think of climate change, from economics to social science to physical science, hydrology, public health. So this is a resource that is available to help the region and fill in that gap. And we're already looking at aspects of dust storm, water quality, air pollution, and policy. The ultimate goal is pushing policy that will help address climate change. And I can talk a little bit more about other aspects in the later on.
Thank you so much. Amazing work. Dr. Bassam Kaddissi. So I want to ask you, what prompted the launching of the Arab Center for Healthcare Sustainability within the Arab Hospitals Federation, and how does it tackle the urgent need for actions in addressing climate change?
Well, thank you, first of all, for having me in this session. It's a great pleasure for me and for the Arab Hospital Federation to be part of this COP28 session related to healthcare. As we were hearing in the previous sessions from the ministers, that we should go into actions. So we are all attending and promoting sustainable design, sustainable approach in the healthcare sector. But I guess, or we also in the Arab Healthcare Hospitals Federation, it is the time to start seeing actions. And this was the reason why we have launched the Arab Center for Sustainability, where we have experts within the federation who can support also in promoting the healthcare. We have signed also, as the doctor was saying, with some universities in Lebanon, and we are also planning to do this abroad, to have this advocacy role and to play this important link in between, in between the educational and the NGOs and the WHO as well for all of this approach. We have also the training sessions that we can start promoting with in partnership with the private and the private sector. Thank you.
Thank you. Thank you so much. And I'll come back to you because I have another question on that. Ms. Desta Lakew, you're bringing to this discussion the NGO perspective. Can you tell us more about the work you do at AMREF, and especially to create awareness on the link between climate and health?
Thank you very much, and I'm really happy to be here, and I'm really happy that we have two women on this panel, because women and children are often affected disproportionately around climate and health. I think first of all I want to say, I don't know how many of you, because this is not our typical audience, but how many of you know AMREF Health Africa? We're the largest Africa-based health development organization, and our work really is between supporting governments and ministries of health and community. So it's really linking the last mile to first access care. So that's where the space that we're in. For us, Sharm el-Sheikh was the first COP we had attended. In fact, we weren't even sure if that was where we should be. And when we arrived, what we realized is that health was not a pillar in the COP conversations. And that really got us thinking that we Africans, especially in sub-Saharan Africa, we are less than 4% contributors, but we are seeing a devastating impact of climate. You see things like Malawi's recent cyclone Freddy, which actually killed and affected Malawi more than COVID did, that one cyclone. And what we realized is that we needed to change the narrative for Africa, and we needed to convene, and we leveraged our convening capabilities to bring together African ministers of health so that they can have prominence, convening Africa Group of Negotiators, our regional bodies like Africa CDC, Afro, WHO Afro, to the table to really discuss how can Africa present itself stronger. And so we actually put together a common position with all of our partners and ministers of health. Yesterday at Health Day, we came together again to have this discussion, and today at the Mozambique House, we will also have our final engagement, and it's really to focus around 4 key things. First is mitigation, which we believe is important, and second is adaptation, loss and damage, and financing, because for Africa, we need stronger health systems. We have very fragile health systems, and so this is what we prioritized, because we have to support the Africa agenda on climate.
Thank you, and we made huge progress from COP27 to COP28, so it's in 1 year, yeah, it's very impressive.
There are 20 African ministers here.
Yeah. So, Dr. Ahmed Taha, we had a discussion before the panel about the great work you've been doing on green hospitals, the framework and standards you've defined. Can you elaborate a little bit more on that? Because the whole idea of this panel is to share actionable solutions, and I'm sure that it can inspire our audience.
Sure. Allow me first to congratulate the United Arab Emirates for hosting and organizing such a fascinating gathering and international event. And for, of course, also and for the National Day they are celebrating at the moment. And back to your question, you know that Egypt is very much committed to the sustainable transformation, and we are among the countries who signed the first agreement about transformation in Kyoto, in Japan, and afterwards in Paris, and we hosted COP27. And in light of this, we as GAHAR, which I'd like to define at the beginning, we are the general authority for healthcare accreditation and regulation in Egypt. And this authority is responsible for issuing standards for implementation of quality and accreditation into the healthcare system, and it is the gate upon which all the healthcare facilities should pass through in order to join the universal health coverage, which is the very national and very important project at the moment. In light of this also, we have a separate sector of standards that is dedicated for the environment. We call it environmental and facility safety standards. Each and every healthcare facility has to implement in order to have accreditation. But really we didn't find it enough in the era of global warming and the threat we are facing at the globe and the planet. We need to dedicate some standards dedicated only for green transformation in order to help the facilities to transform into the green ones. So we issued set of standards. We call it standards of excellence for transformation into green and sustainable healthcare facilities. And they are based on 8 principles. One is the leadership commitment and planning for transformation into the green and sustainable healthcare facilities. Second is waste management. Third is energy, proper utilization and efficient utilization of energy, specifically on energy saving and transformation into clean and renewable energy. The other point is the water management and the waste management, specifically recycling of the waste and reuse it in a different way, even for energy production. And also we have standards that speak about the utilization of the proper getting rid of the chemicals. That's that's the side product of the health provision. Also, we have standards related to the ethical and sustainable procurement. And finally, which is very important as well, we revise the healthcare designs, the design before the building arrives, in order to be sure that when the healthcare facility is built up, it will be matching with the standards that we need in order to be a sustainable and eco-friendly healthcare facility.
Amazing. And what have you learned so far in implementing those
standards?
Well,
we already we pass into 3 important points. First is campaigns of awareness, along with an agreement and protocol that is just renewed today with AstraZeneca. They are very important partner to us. They sponsor campaigns of awareness to the public and also training courses to the service providers in order to know what the importance and how they implement the standards of green hospitals into their facilities. And the third one, we already implemented these standards into some of our hospitals. One of them is the Sheikh Al Orman Hospital, which is found in Luxor. I just would like to show you the results of the implementation of one of this one, which is just a small hospital, is just 150 beds dedicated and specialized for the care of patients with malignancy. You can just see that solar cells have been installed in the hospital. They managed to convert 15% of the hospital's energy to clean, renewable energy. They reduced the hospital's carbon emission based on that by 500 tons annually. This results in financial saving of 1.5 million pounds annually. So it's also its profit value. They also achieved to decrease the electricity consumption by 20% annually. This led to decrease in the carbon footprint by 700 tons annually, with a financial saving as a result of that of 2 million pounds annually. So they also followed a program for reducing water consumption and approximately reduced 19% of water consumption every year. Waste management, they followed a waste shredding and recycling plan with sterilization instead of incineration, with a financial saving of about 3 million pounds annually. So, I mean, implementation of green standards is not only to save the planet and save the people, it's also, you can also achieve profit out of this. Thank you.
Thank you. That's an amazing case study, and thanks for highlighting the financial benefits as well to go into green standards. Moving on to you, Dr. Stephen Holt. Why has CEHA identified kidney care as a priority for sustainable initiatives, and what have you learned so far?
Well, thank you very much for inviting me. We know that in nephrology we're very bad at our carbon footprint. we've got some now data, some good data, showing that as kidney disease progresses, we produce excessive carbon CO2 in the atmosphere. So as we progress from stage 1, we produce around about 1.5 tons per patient in CKD, right through to dialysis patients who produce nearly 13 extra megatons of CO2. So it's very expensive in terms of CO2 production. But it's not only very expensive in CO2, it's expensive full stop. So we know we're both financially a big burden. We know that we produce very large amounts of carbon dioxide, and we have to get better. So we're expensive because we use a lot of energy, we use a lot of water, we use a lot of single-use plastics. And we have to become more sustainable. And so a lot of the work we've been doing is to, one, quantify our carbon footprint. And no surprise there, we found that our carbon footprint is pretty bad, but it gets worse the worse your kidney disease. So some of the work that we've been doing here in the UAE and with AstraZeneca is to try and catch patients early, treat them early, and prevent them going on to later stages. And in that way, we not only help our patients, because we don't want them to be dialyzed, we don't want them to be transplanted, but we also improve our sustainability. And the other thing that we do quite a lot is we try to transplant patients. And the UAE has just been named as the most improved transplanting country in the world. And this is a strategy which means we not only improve the care of patients, but we're also improving the carbon footprint because transplantation also has a much lower carbon footprint. We're also aware that a lot of our patients use a lot of transport, and transport is a big driver of CO2 production. So we've been doing a lot to try and look at that and to use telehealth solutions where we don't need to. And one of the projects I was involved with in Australia, we cut our carbon footprint quite dramatically by just doing some follow-ups with telehealth rather than asking patients to come to hospitals. So lots of really practical things that we can do in nephrology to not only help our patients, help the finances, but also help the CO2 footprint. We also have some very good implementation of waste management as well. And we're hoping, and you gave a really good example in Egypt of processing waste locally. Because we use such a lot of single-use plastics, if we could only reprocess that on site and then find a purpose for that, either syngas or just reprocessing into other things, we would save an awful lot of carbon dioxide. Because otherwise it's just taken away by road and burnt, and more CO2 comes into the atmosphere. And we have to stop this. It's not sustainable. But these solutions don't have to cost money because we've shown how the return on investment is really very short. And as you've said, if we can show the financial sustainability as well as the good we're doing for the CO2 footprint, we really are going in the right direction. And we have to do that because for many countries, renal care is almost unsustainably expensive. And we really want to find ways to try and prevent people not only from progressing down chronic disease pathways, but also from stopping them having to be dialyzed. And that's a really important goal because we now have much better treatments for early chronic kidney disease. And if we can implement those widely, then we can stop that very large CO2 production of all of our patients in chronic disease space.
Thank you.
يعطيكم العافية وشكرا.
Muna, can you tell us more about the initiatives that African Global Health is undertaking to achieve sustainable healthcare systems?
Absolutely. Thank you so much. Allow me to thank the organizers and AstraZeneca for having me today. I would also like to apologize on behalf of our president, Dr. Imane Kendili, who was supposed to be here today, but couldn't make it. So to answer your question, African Global Health is a Moroccan initiative composed mainly by African experts from diverse countries in Africa and more. And AGH is dedicated to fostering sustainable health policies. And in order to do that, the objective is to unite scientific experts, economists, lawyers, and policymakers, fostering collaboration on a continental scale to reconceptualize public health policies. So in African global health, collaborations with local communities, governments and healthcare providers to understand specific needs and challenges is very important. With our experts and ambassadors, each one of them is a connector to their own government and healthcare providers and other sectors that can make the difference upon their communities. We advocate for policies that promote health sovereignty, such as equitable access to healthcare, strengthening healthcare systems, and supporting local health initiatives. So we form alliances and partnerships with our other NGOs, international organizations such as African Union, Africa CDC, and governments to amplify the impact and reach health sovereignty initiatives. So,
thank you.
Thank you.
Thank you so much. Thank you for highlighting the importance of partnership in this issue. I want to come back to you, Dr. Bassam Kaddissi, because I'm sure that you have a lot of experience and you've seen a lot of models from hospitals in various countries. So I want to ask you, have you observed differences from one country to another, or have you seen any pattern of a model of hospital that is emerging?
Well, thank you for the question. It's very important because this is the aim of meeting here, just to have lessons learned, to share ideas, to share experiences, and the joint effort between the public, again, and the private sectors. Actually, there is not a single model for a hospital to be copied and pasted all over the world. Whatever is applicable in a certain geography, definitely it will not be applicable in the other one due to several reasons, whether it is political, geological, climate, whatever, financial, as the ministers were saying. So we at the Arab Hospitals Federation, we have launched the Gold Initiative Certificate or Champion. This is one of the roles of the AHF in the region, other than the strategies that we have. So I'm talking specifically about this certificate because it allowed us to learn more the Arab countries. Once we have launched this certificate, which is related to the climate change challenge in the healthcare sector, we have received applications and participations from almost 47 hospitals from the region. 9 out of the Arab countries, 9 countries have showed interest in participating in this. There were different approach or different fields to apply for, whether it was waste management or the sustainable design and architecture or whatever is needed for the waste treatment, etc. So, and we learned that there is nothing in common between these. However, Cleveland, I will just mention few, just an example, because these were amongst the most, the 10 awards that we have submitted, the Cleveland Hospital and the hospital in Sharm el-Sheikh also. And we have the Bellevue Hospital in Lebanon, despite maybe all the challenges that we are facing in Lebanon. But they showed good resilience approach in this field. I guess the common platform for sustainable design would be the incentive, and maybe you will not agree with me, or most of the audience wouldn't agree with me, to have a prototype to copy paste and have it in all countries, but at least the base should be there, and then everyone will deviate in its own direction based on the challenges and the resources they have. And this is what makes us evolve more and more, and to have some more and more expertise. And this is what we are all facing in the COP27 was different than COP26. COP28 is surely different than the 27. And we are all looking for the coming COPs, especially for Africa as well, because I know the challenges there are also significant. Exactly. Thank you.
Thank you. Thank you so much. I want to come back to you, Dr. Wael. You touched upon the great work of GeoHealth Hub. And I want to ask you, what are the strategies that you've implemented so far that have proven to be successful?
Yes, within just 1 year, the GeoHub has been funded just for 1 year by the United States National Institute of Health. We have held 2 conferences, regional conferences, on climate change and health. We have trained about 10 master's students and 5 PhD students. One of our trainees just got accepted at Harvard in a very competitive way, so we're very proud of that. We are also now negotiating and discussing with ministers of health on how can we help a country to advance climate change health impacts. So we have a champion, Dr. Firas Al-Abyad, who was here, and he mentioned he is really utilizing this tool and saying, here are my needs. How can you help me? And with policy, there are processes to do that. First of all, there should be assessment and agenda setting. Second, there should be planning. And we can always help with that. And then it has to be evidence-based policy. And the evidence, as was mentioned, has to be local. You can't bring evidence from Europe and apply it to the MENA. So that's why we are trying to help with that. And then, not just that, the implementation, the enforcement, and the evaluation of such policies is really important to see how this is successful and we can expand it. So the idea is we work as a region, starting with Lebanon, maybe Jordan, maybe Morocco, but any other willing partner who is willing to utilize this free service. We're not asking money. We do have the funding to help really the region. That's the way of thinking. As a kind of a side aspect, well, I got just funded a large center called the Global Center on Climate Change, Water, Energy, Food, and Health, which is very competitive to get. And we were awarded just a couple of months ago. Also focused on climate change and health with a prototype of how we can create a solar desalination system that would provide water, and we measure its impact. Now, all of these aspects may not relate directly to healthcare, but all of them are going to serve in prevention and addressing the resilience. However, on a side note, as part of our, let's say, state-of-art advances, with our team in Jordan, we have now implemented or developed the first hospital climate healthcare resilience index, led by Dr. Faiz, who's an engineer, but because it's very multidisciplinary. So this is an index that can be used, for example, by the Arab Hospital Association and others, and then we can have some baseline to see where each one is at. Or the green hospitals, they're probably going to be very high in this index. These are some of the examples we can provide. Do you want me to say the challenges, or are you going to save it later?
No, please go ahead.
Okay. The main challenge is having the region work together. That is our main challenge. Everybody wants to work on their own area and not interested. Exceptions are like Dr. Firas Al-Abyad, who's really open-minded about that. So that's a major challenge. The second challenge is access to data. So we need data to advance science, evidence, training, and we are not asking for any cost to do that. We are doing it as trainees. We can have a PhD student develop this. Everybody's holding to their data as if we are going to go and abuse it or anything. One other project that I have that is relevant to this is the research ethics education program for the region. And we train hospital, healthcare professors on how to deal ethically with data. So it's not like we're going to abuse the data. We want it as a partnership. Climate change cannot work on a city. It works on a region. It doesn't even work on a country. I mean, a country is okay, but we need a region. So unless we have comparative data, we cannot advance. So that's the real challenge we're dealing with.
This is a clear call to action. So let's wrap up the session by the challenges, and I would love to listen to you as well. What's the main challenge now to move on building more sustainable healthcare systems? What do you think is the main one? Please.
Yeah, I don't want to move to challenge just yet because we all have challenges, right? So maybe let me just talk about the opportunities based on the research and the work that you're doing and some of the work that is being done here. So for us, as a region, 40% of sub-Saharan Africans don't have direct access to care, right? So let's talk about that as a challenge, but it is an opportunity also. And what we've really done in our region, certainly, and with AMREF certainly, is that we have looked for really practical climate-conscious solutions on how we get this 40% to access first-level care. And remember, our populations, this 40%, are dealing with conflict, COVID recently, climate certainly. So what we've really looked at is what are creative solutions. We had tried actually camels. So wherever there are migratory routes, we actually have camel clinics. And then we pulled forward and said, with the help of AstraZeneca, we now have mobile units, basically, that can hitch on to any vehicle and that can access any community. And these are really with satellite, with the not a satellite, but they are climate ready, refrigerated satellites, and we can go out and actually do vaccines. So we've been using them, I think, over the last couple of years. We've reached last year. This came out after COVID. Is we have vaccinated over 144,000 people across 3 countries. We use it now. It's an easy solution. So how do we find solutions? We have to find those solutions. We have to work together because what we realize also is that it's important. When you want to go fast, you go alone, but when you want to go far, you go together. So as a continent, we've been trying to really pull together our resources and our priorities. But I just want to come and say to you, our first line of defense in everything that we do are community health workers. They're the people who connect the last mile to first level care. They are also the people that we are looking at to do surveillance, data collection, right? Community-based surveillance. And it's been very successful when these community health workers, if we can build their capacity and train them and remunerate them, because many of them are not paid, these community health workers actually give us information at the community level that we can collect as community-based surveillance and use also for decision making. So we have a very robust system, digitally equipped community health workers that have already shown that what a difference they can make. In Tanzania, there was a case of Marburg, and one of our community health workers actually noticed in her community that there were people from one family being taken to the hospital and they would die. And so she questioned that, and it got to the Ministry of Health, and that happened to be a Marburg case, and they were able to contain it. So we need to leverage. We don't need complicated things. Even simple solutions can make a tremendous difference. And so it is really about partnership. It's really support from our partners here and intelligence and information from you here around the table, certainly, to lead us. But small things can make a big difference.
Thank you. Thank you for helping us seeing the upside of the risks. Yeah. We have our colleague from, before coming back to our panel, our colleague from the UAE Ministry of Health who wants to share some insights. Do we have a microphone?
Sure.
Good day, everybody. I'm Dr. Maysoon Al-Shaali from Ministry of Health and Prevention. Actually, I'm honored to be here with you and welcome everybody to COP28 in Dubai. We just wanted to share with you our pilot study of carbon footprint analysis in 2 main hospitals in UAE. Ministry of Health and Prevention plays a pivotal role in sustainable and climate resilient healthcare facility. We collaborate with environmental experts to conduct this pilot study, and our colleague from EY company, Mr. Sarvanan, will give you the results of this study. Thank you.
Thank you.
Thank you so much, Dr. And thank you for this opportunity to quickly share what our collaboration with the Ministry of Health has come out. So it's a study to actually to see within the hospitals here in UAE, where do they stand in terms of collecting the data related to carbon footprint, because I can see that some of the panelists already reflected data is actually really a challenge, especially within the hospital environment, because it's not only about the scope 1 emissions and scope 2 emissions, but it also a hospital generate a good amount of waste, which actually in turns actually contributes to scope 3 emissions as well. So we were able to do a study, a pilot study for a major hospital in Ajman and also as well as in Abu Dhabi. And also we try to benchmark their footprint, per employee, per bed, or per number of patients. And not very surprisingly, the energy intensity and the carbon intensity of the hospitals here is not in a way great in terms of performance compared to the hospitals in Europe or even within the region, some of the private hospitals. So, but this also gives us a great opportunity, in a way to reduce the emissions, yeah. And also to create a pathway, and we have agreed upon and to see that the hospitals under the Ministry of Health will be able to hit the target even much before 2050 UAE net zero. So we have created a scenario, and those are cost attractive and economically feasible scenarios for the hospitals to achieve. I'm so happy to share this result, and hopefully in subsequent meetings we'll be able to cover for the whole of UAE the outcome of the study. Thank you so much.
Thank you so much for sharing. And we will have time after the panel to continue the conversation and share more sustainable practices. So last word about the challenges before we wrap up this panel.
Well, if you allow me, I can find that the public awareness is the real challenge. We have to create an urge for transformation. People should be convinced that we are in a real threat for the globe, real threat for the mankind. So we need to create a sort of urge in our homes, in our factories, in the faculties, and everywhere. So otherwise, our efforts is going to vanish afterwards. Second is, as has been already mentioned before, the funding and the private sector engagement is very important as well. And to find key indicators of what we are doing in every facility. There must be something to measure. We have to measure the carbon dioxide emission in everywhere, because what we can't measure, we can't moderate, or we can't manage, and even we can't enhance afterwards. So it's very important to have a key indicator in every facility about the carbon emissions, about the power saving, and all the indicators that you already mentioned before should be measured and should have a plan to be enhanced and improved afterwards.
Thank you so much, and I see awareness and education as an emerging challenge. Please.
I see no lack of enthusiasm for getting this done. From the frontline staff to the management, everybody is on board. And this is exciting, because it's time now to grab that enthusiasm and make it work. We now just need the government assistance to encourage and to enhance this. And I'm sure that this great awareness will move us on to the next level of sustainable healthcare.
Thank you, and I'm sure that COP28 will help as well to move the needle.
Well, when we talk about challenges, it's always good to talk about mitigations as well. So for me, the main challenge are two, if I may say, political and financial. Because in order to regulate this and to have some legislations and accountability, this will allow us to have access to everything or every single topic that we have addressed, access to data, accountability, monitoring, and having everything access. So I guess it should start at a higher level. We are all joining our efforts, of course, to achieve the target, but it's always good also to look into mitigations and actions again. Thank you.
Thank you. Thank you so much for your insight. Please.
I'd like to join Dr. Bassam on what he said. Among the challenges, they lie, well, I'm talking about Africa. So they lie in infrastructure, human resources, and regulations that take time to be implemented. So as Doctor said, it needs to start from the top. Thank you.
Yeah, the leadership. Yeah.
Let me just add to what she said. We actually, as part of the common position, the meeting that was completed yesterday, the African Ministers of Health that convened agreed that they will have a multi-country task force to actually work on pushing ahead the climate agenda. So certainly collaboration is important. We have a lot to do around capacity building, health system strengthening, training of our health workers, et cetera. But politically, I think we're aligned.
Thank you so much. Thank you all for your insights. I can see, many inspiring solutions that exist that we can implement. No lack of enthusiasm for sure, and definitely a need for partnership and a greater leadership on climate and health issues. So really, thank you so much for coming, and thanks for joining us for this event. A round of applause.